The ability to provide end-of-life care is a major concern to family members. However, some families cannot provide end-of-life care because of cost of service, incapability to care for them, or inaccessibility of supplies, especially for poverty-stricken areas. It is impossible for family members to have a peaceful death. People are ignored the help they desperately need for their medical condition. Their deaths are often painful because of their inability to have the help they need. Because of their circumstances, people are not being cared for or loved due to a lack of aid. They are not represented to their fullest dignity in their last days. Common themes for these issues are life and dignity of the human person, call to family and participation, option for the poor and vulnerable, and solidarity.
The church document of Forming Consciences for Faithful Citizenship was written by the U.S. Catholic bishops in 2007, with the rationale that Catholics should bring their moral principles from which were formed by the Catholic faith when debating or discussing issues. The document supports solidarity through community actions and stresses the importance of having a dignified death in union with the living. Reestablishing the priority of the souls of those on their deathbed could be offered as a possible solution for eliminating any issues met while promoting the solidarity of the community and the dignification of the dying. Another possible solution to our problem could be the unification of the community to help pay the costs of the aid required for a person's death to be dignified or to donate supplies, money, or time.
Sunshine Haven was dedicated on November 4th of the year 2000. Its planning began in 1998 by a group of Brownsville residents led by Luis del Castillo, RN. Sunshine Haven's goal is to provide a peaceful, home-like, loving atmosphere where patients with a terminal diagnosis may die with quiet dignity. This goal is reached through private and public contributions and grants, as well as donations from Brownsville foundations and a home-like setting.
How do you personally contribute to the community by working here?
One, my contribution is organizing the agency, overseeing what we do, making sure there's enough funds to keep the doors open, applying for grants, making sure that everything administratively is done and it's on par with everything for the state because we are licensed to, making sure that our nurses continue their continuing education, making sure that it's paid for, making sure that everything that we have is in line, risk management, making sure that we are adhering to everything, so again, to avoid lawsuits and things like that.
How does Sunshine Haven help its patients keep their human dignity?
What we do is we provide 24-hour comfort care. What that means is, trying for them to spend their last couple of days, or their last few days, last few months, in dignity, without pain, making sure they're clean, making sure they're comfortable during their last final days, and that's what our mission is.
How long do you keep patients after they've passed?
They need to be,
Immediately?
taken immediately because we do not have a refrigeration system to keep the patient, so they must be taken immediately. So when families come in to sign up their loved one, we always ask them, do you have a funeral home that you're working with? If they don't, we urge them.
How frequently are patients monitored?
Oh, the girls go in, and they go in once sporadically, one to administer medications, two, they go in every 2 hours to reposition the patient to avoid bed sores because those can be very painful, and then also to treat bed sores if they're coming in with bed sores. So they go in all the time, they're in with the patient, administering medication, changing diapers, feeding, doing things like that.
Well, can you explain to us about how it's not a hospice?
We're not a hospice. We're a special care facility, and that's exactly the way we are licensed by the state of Texas, okay? The reason we're not a hospice is because we don't bill anybody. Everything's based on donations and a few grants that I do apply for, to keep, the operations going. But again, we do take solely hospice patients. And why only hospice patients? I've had families call and say, I want to take my loved one there. Do they have hospice? No, I can't take the patient. The reason we require hospice is because, again, we do not have a medical director and we do not have a registered nurse. Again, those are very costly salaries that we cannot afford. As a nonprofit, since we don't bill anybody, we don't take their Social Security like they do at nursing homes. We don't take Medicare, Medicaid, private insurance, and we don't send out a bill either. Everything's based on donations. So again, we can't afford that. And so the reason being for them to have hospice and the requirement for the patient to have hospice, because hospice will provide us with a CNA that will come in and bathe the patient every day. They'll provide us with the registered nurse, the medical director, doctor's orders for the medication. They'll provide us with the medications, comfort equipment, oxygen tank, suction machine, concentration machine, things that will help keep the patient comfortable during their last final days, including diapers, gloves, everything else that we will need to take care of the patient.
If people do not go to any type of hospice, do you think they will still die in dignity?
They can die in dignity, however, death can be very painful depending on their diagnosis. Unfortunately, human error does occur, and we see it all the time when patients are being taken care of at home. The medication isn't administered properly. They're very anxious because of the pain, or they're going into terminal anxiety where they get very anxious and they don't know what to administer, or they don't want to administer the medication because they think the medication is killing them, when in fact it's actually the disease. Whatever their terminal diagnosis is what's killing them. It's not the medication. The medication is to keep them comfortable. So when they're here, the girls are trained and they know exactly what to do. So that's why they're, it's comfort care.
Do you think it violates the right of a dignified death if they don't go to a hospice?
Well, no, because we need to respect, the patient's final wishes. It's whatever they want. However, that's why one thing that when they come in to sign up the patient, I always ask, who has the medical power of attorney? Because you have powers of attorney for different things, for their estate and one for medication. So that person, if that patient is not coherent and they're not able to make a decision about their health care, who can make that decision for them? So we always ask that. That's very important, and it's something that's signed by the judge and an attorney. And so we go based on that, because sometimes we don't know.
Is Sunshine Haven religiously affiliated?
No, we're not. We do have a chapel, but it's non-denominational, and we want to keep it that way because we serve everybody.
Is the sacrament of anointing of the sick or anything other religious sacrament administered here?
Yes, and that's done through hospice. Hospice, do have a chaplain that comes in. If the family requests, they can bring in their own priest, whoever they want to bring in, to bless their loved one. That is allowed.
Has anyone refused to be here, as in like the patients?
Most of the patients that come in, you have to understand, they're actively dying. Mm-hmm. All right. Sometimes they don't want to be here because they know that this is their last resort. That's it. They're coming in and they know what Sunshine Haven is, and they know they're coming to die. And it's not that they don't want to be here; they don't want to die, and that's acceptable. Nobody wants to die, but once they accept, then they have a pretty, comfortable, end of life experience.
Yeah. How are patients remembered after they pass? Or are they?
Well, there's memorials. As a donation, what families can do in lieu of flowers, they can do memorials to, in memory of, so on and so forth, in honor of. There's memorials. And right now, last year, we've just celebrated our anniversary for our memorial pavers, which I think when you walked in, you saw there was a section there, and they can buy pavers, at different prices. And that's another way to memorialize their loved one.
And is there support given for grieving family members and their patients?
Yeah, and that's done through hospice, again, through the chaplain. They have counselors, they have caseworkers, social workers. They have the registered nurse that comes in also.